second that y'all are done with basic training and AIT, and now you're with your units, and you're in a combat environment. And during a patrol, your unit comes under fire. Okay, and during a firefight, you look over and you notice that one of your battle buddies is laying on the ground and he's not moving. He or she's not moving. So what would you do? This class is going to be on casualty combat care, and hopefully I can answer a couple of those questions. There's 4 things that we're going to talk about with casualty combat care. The first one is moving safely to get to the casualty. The second one is how you evaluate the casualty and how you treat the casualty. The third step is the additional things that we're going to need to do at the site. And the fourth is there's also a time when not to treat the casualty, so I'm going to talk about that. Next slide. Okay, before you approach a casualty, soldiers, you have to make sure that you have a plan in place. Okay, you have to have a route to get there, a safe route to get to the casualty, and also to get back to your spot where you were undercover. You have to check for the different types of dangers. Okay, next slide. Here's some of the kinds of dangers. Of course, small arms fire is going to be one of the dangers. You're not just going to run out and get shot yourself, right? Also, fires, or if there's any explosive devices around the casualty, you're not going to go. Next slide. Okay, this is the most important slide, soldiers. Remember that at no time, if your life is in danger, are you going to go out there and attempt to save somebody else. Because what happens then is now we're going to have 2 casualties that everybody else has got to worry about. Make sense?
Yes.
Okay, next slide. Okay, so we've already talked about how we're going to safely get to the casualty. The next thing is what we're going to do while we're at the casualty. And the first thing we're going to do is we're going to check the casualty for responsiveness. We do this by going up to the casualty and we're going to shake them on the shoulder gently. And we're going to simply ask, are you okay? Okay, make sure that you use a loud enough voice so that he can hear you. Also, AVPU is on there. That's the Army acronym for checking alertness. Okay, there's different levels of alertness. The A stands for that he's fully alert. The V is going to stand for he's responding to voice. P is going to be responding to pain. And U is going to be unresponsive. Okay, if the casualty is conscious and you go up and you ask him if he's okay, and he says, no, I'm not okay, I'm hurt here, then you know that this is the area that you got to focus on. So you could ask him where he's hurt at. Next slide. Okay, if the casualty is unconscious and he's on his stomach or on his side, we're going to position the casualty onto his back so that we can better evaluate the casualty. And that just shows how we're going to do that. Next slide. Okay, step 2 is going to be we're going to check for breathing. Okay, we do that by look, listen, and feel. We're going to position ourselves next to the casualty's head. If everybody can see with our face next to their face, so we can look down and see the rise and fall of the chest. That's going to be the look. Okay, up and down the chest means that the casualty is breathing on his own. All right, we're also going to listen. We're going to listen for the sound of breathing, or we could also hear if there's anything stuck in the airway that's stopping him from breathing. And last, we're going to feel. With the side of our face, we're going to feel the breath hitting our cheek. Next slide. Okay, there's 2 ways when we're checking for breathing to kind of open up the airway, and that is the head tilt, chin lift, or the jaw thrust. If you suspect that the casualty has suffered a head or neck injury, you're going to do the jaw thrust. Any other way, we're going to do the head tilt, chin lift. Next. Okay, if whenever you're listening and you're checking for breathing, and it sounds like there's something obstructing the airway, we have to get that thing out. So we're going to do the head tilt, chin lift. We're simply going to take our fingers and we're going to scoop inside the mouth and pull out any foreign objects that might be in there. Next. Okay, soldiers, if the casualty has an open chest wound, meaning he has a big wound to his chest, and that's what's prohibiting him from breathing correctly, but the casualty is attempting to breathe on his own, then we're going to stop what we're doing, and we're going to address that wound. If you come up to a casualty that has an open chest wound, and he's not attempting to breathe on his own, then we're not going to treat that casualty, and we'll talk about why in a little bit. Next. That's just a picture of a soldier that suffered an open chest wound. Next. Okay, step 3. We're going to check the casualty for bleeding. Bleeding, we first check for any obvious signs. If the casualty is in a pool of blood, then we know that there's some bleeding going on. We also look for an entry and exit wound from a gunshot. Then there's some kind of bleeding going on somewhere. If you approach a casualty and there's life-threatening bleeding coming from an extremity, meaning an arm or a leg, you're going to stop what you're doing and you're going to apply a tourniquet, what we call a combat action tourniquet. The tourniquet gets placed either 2 inches above the wound, or if that's on a joint, like a knee or an elbow, you're going to place it 2 inches above the elbow or the knee. The most important thing whenever we're applying a tourniquet, you're going to keep applying pressure on the tourniquet until the bleeding stops. But you have to mark the casualty. You're going to mark the casualty with a T for tourniquet on the forehead, and also the time that you place the tourniquet, because it's important for medical personnel to know how much time the tourniquet's been applied. That way they can try to save the limb. Next. Okay, so we talked about approaching a casualty safely, and we also talked about what we're going to do to evaluate and to treat the casualty. There's some additional things. If we treat a casualty, we're not just going to say, okay, you're okay, and we're going to walk away. So there's some things that we have to do. The first thing is we're going to send a soldier to go find a combat medic. We're not going to leave the casualty ourselves. We're going to stay with the casualty. So make sure one of your battle buddies goes and gets a medic right away. Whenever you're with the casualty, you're going to monitor him or her, to make sure that the wounds don't progress and they get any worse. And then we're also going to keep reassuring the casualty, let them know that, hey, help's on the way, you're going to be okay. Next slide. Okay, it's also going to be our responsibility, because we were the first ones to provide care. We're going to do the medevac request because we know the extent of the injuries. Medevac request is this: you're calling over the radio for a helicopter to come and pick up the casualty. Okay, next slide. Okay, last thing we're going to talk about, there is a time in combat when we're not going to treat a casualty. And that is whenever your life is in imminent danger, you're not going to leave your covered position and you're not going to go treat a casualty. Because we already talked about how then we have 2 casualties, right? Also, if there's multiple casualties, and casualty over here has some symptoms and the other one has his arm blown off, we're going to treat the more severe cases first. Understand? Okay, in a combat situation, if you find a casualty that has displaying no signs of life, meaning he is not breathing on his own and he or she does not have a pulse, we're going to stop treatment because we can't help them at that point. Next slide. Okay, circumstances when you should not treat again. If they have a penetrating head wound and there's brain matter on the ground or exposed, we're not going to treat that. And if there's mutilation from a blast, meaning half the body's one place, half the body's in another place, obviously we can't treat that either. Next slide. Okay, so in conclusion, there was 4 steps that we talked about. The first was moving safely to the casualty. The second was evaluating and treating the casualty. The third was the additional duties and our responsibilities. And the fourth was when we're not going to treat a casualty. So in closing, just remember that once you get into the operational army and you're a U.S. soldier, you're going to be expected to know how to treat your battle buddies on and off the battlefield, okay? It's a skill that you're going to learn a lot more about, so don't think that whenever you leave the room today that you're going to be expected to know that. And if you have any questions, I'll answer them at that time. All right, that's the rest of the class, but let's go